Okay, let's talk about mastering SOAP notes for really effective clinical documentation.
So, let me ask you, are your notes really telling the patient's whole story?
Because at the end of the day, it's all about clear communication between professionals.
Here's what we're going to cover, from why notes matter to exactly how to write them. And this is where the SOAP note comes in. It's a simple but super powerful framework.
First up, S is for subjective. This is literally the client's story, in their own words.
Using direct quotes like this is huge. It gives you incredible insight into how they're feeling.
The key is to just capture what they say. Don't add your own judgment.
All right, next is O for objective. This part is all about observable, measurable data.
So, stick to what you can actually see and measure. No assumptions or labels here.
Now for A, assessment. This is where you pull it all together with your clinical analysis.
I like to call this the so what part. What does all this information actually mean?
Your assessment needs to explain your thinking, not just restate the facts you already listed.
And that brings us to P for plan. This lays out the next steps for care. But you know, a plan is only effective if its goals are clear. That's where SMART goals come in.
Setting SMART goals is an absolute game changer for making treatment plans that work.
First, S for specific. The goal has to be super clear with no room for confusion.
Then, M for measurable. You got to have a concrete way to track progress. A is for attainable. Is the goal actually achievable for this client right now?
Next, R for relevant. Does this goal make sense for their overall treatment?
And finally, T for time-bound. Every single goal needs a clear deadline, period.
So to wrap up, be specific, quote your client, explain your reasoning, and set SMART goals.
Because really, it all comes down to this. Stronger notes lead to a stronger practice.
So, that leaves one last question. What will your next note look like?